that we record all of these. So if you want to go and watch last week's, or you're curious what we talked about a couple months ago, even, you can go find those. Go to bartonwebinar.com and you'll find a link to our YouTube channel there. I highly recommend that you subscribe so you don't miss any of these wonderful webinars that we do. We're doing 2 webinars per week on health topics. So there's a lot of information. You can get just a really good education, I think, on your body, on your health, and how to prevent disease. And just as Dr. Saunders just mentioned, healthy is happy. Mm-hmm. Is that what he just said?
Yeah.
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 So
it's not worth being in pain all the time.
no. So we're going to talk a little bit more about that. And just a quick reminder, Dr. Saunders is a doctor, but he is not your doctor. So that we do recommend that you chat with your provider before you implement any of the things that we discuss today. Say hello if you can in the chat. If you're on Zoom, there's a chat button. Say hello there. Let us know where you are tuning in from. If it's your first time, welcome. Let us know that too. If you have questions as we go, if you could post those in the Q&A, that'd be the best place for us to manage those. And because we don't want to miss your questions. And sometimes that chat cycles and then we have to try to get back, and it can be a lot. So if you can put them in the Q&A, that'd be wonderful. Like YouTube, you can comment. Same with Facebook. Wonderful, wonderful. Okay, so I'm going to start out this discussion a little bit about arthritis with this. I was, let's see, maybe in 6th grade. I was a catcher on my softball team. The runner was running home from third base, and I got the ball. I tagged her out. It was a pretty hard. She slid in, hard, and I ended up breaking my thumb inside of my glove. But I didn't drop the ball. Let all of you know that I didn't drop it. But I broke my thumb at like a 30-degree angle. It was off right on the growth plate, and now I'm starting to experience some pains in that exact same spot. And people have told me it's probably arthritis because you had an injury there. And that makes me nervous because I've had a few knee surgeries. And people say, well, you may get arthritis in those knees later. Is that true? And what do we do about it?
Well, that's a fascinating topic. And there's been a lot of research on this. And it's really amazing how there's just these opinions of experts is so varied and so opposite each other. One of them is like, absolutely, it has nothing to do with anything. And the other ones are like, absolutely, it is going to cause arthritis later. There was an interesting study done on knee injuries in the NFL, so the National Football League. And these are people who have the number one reason for retiring from the NFL is knee injuries. So they have a lot of that issue, right? And so the average length of, I think, a linebacker, the average career in the NFL is like 4 years or something like that, because they get knee injuries and they're out, kind of thing. So there was a study done on when they're told, like, if they get knee injuries, depending on the type of knee injury and everything, then what happens later on, 20, 30 years down the road? Do they get arthritis in there? Because like half the time the doctors are saying, oh yeah, you're going to get arthritis. You're going to get arthritis later on. And the other half, they're not told that. And so what really happens down the road? So they followed them for 20 years, I think it was, something like that. And when they found that there was no correlation with the type of injury and whether they got arthritis, how severe the injury was, whether they had surgery or not, there was no correlation on getting arthritis. But there was a correlation on if the doctor told them they were going to get arthritis, they got arthritis. If the doctor didn't tell them they were going to get arthritis, they didn't get arthritis. So go figure. I mean, does this make any sense? Well, I guess, because what we think about, what we expect to happen is probably part of what happens, right? I don't know.
Yeah, I would expect the same thing if your parents struggled with something, you're like, oh, I'm gonna have, I might get it too. I might get arthritis too. My mom had it. So if you're gonna tell yourself that, just like a doctor tells you something,
Yeah, yeah. So yeah, or that yeah, right. Anytime you have this belief in your head, oh, this is what is going to happen to me,
Well, and
that
sorry,
it could happen.
I think too, so I was starting, this was several years ago. I was experiencing this like plantar fasciitis type pain in my foot. And I was like, that's really weird. I've never had that before. And I ended up, I think I mentioned this before, I ended up doing a Whole 30 and that all went away. And so now, because this is what I've told myself also, anytime I start to get pains that don't go away like that, I'm like, oh, clean up my diet, because I've seen it work, right? For different pains that I've had. So now I'm just really curious for you to tell us a little bit more about arthritis because I want to know what your thoughts are.
Okay. So arthritis is an inflammation in a joint. And so arthritis can be anywhere. You have joints everywhere in your body. And some are movable joints, like your finger moves, right? This one moves, this one moves. So these are all movable joints, but there's immovable joints too that can get arthritis in them. So along your sternum, people get what's called costochondritis, which is an inflammation of the joints of the ribs connecting to the sternum. And they're not movable joints like this. They're movable joints in that they just kind of bend a little bit, so you can take a deep breath, and your ribs can go bow out a little bit, and then you breathe all the way out, and they bow in a little bit. So as they go in, so but it's not like a joint that moves against something else. Other joints that are immovable, like sacroiliac joints, that's your sacrum on your butt, on the top part of the hip, right there on the very back. There's two joints in there that are immovable joints. In fact, they're kind of like uh, so stitched together, but they move just a little bit. And if they stretch or something or move too much, you can get sacroiliitis. My son has this, and it's a common thing with something called Reiter's syndrome. Uh, People that have a genetic tendency to arthritis. So there are genes that seem to allow this inflammation to happen, and it can show up in joints. But there's a lot of other reasons too. There's things that you're allergic to or sensitive to in the air, pollens in the air, and things can bring on arthritis. Food sensitivities are very common. In fact, like 80% of the time, people that have rheumatoid arthritis or osteoarthritis or other arthritis that's not characterized specifically as one of those, you can relieve that arthritis, just like Leslie was saying, by changing your diet. So sometimes that works really well, but that's not everything. There are other reasons for having arthritis. You can have injury, like a chronic injury. I was talking to someone just the other day. Their pubic bone, there's a pubic symphysis, which is a non-movable joint where the hip bones in the front come together, the pubic bone, and when she started running, she started getting pain right there in that pubic symphysis. She got arthritis, and it was because of the way she's running. So I sent her to physical therapy. The physical therapist is going to explain to her how she can run and not injure that joint and not cause problems to it. It's kind of similar to something called shin splints, where when people run, if you run on your heels, every time you get a heel strike, the muscle that holds your toes up and holds your foot up as you're heel striking, you kind of jerk it and you pull it away from the bone. And then that can cause, that's not arthritis, that's actually along the bone, but people get shin splints from that. but that's kind of similar to what that pubic symphysis problem is with running. So there can be injury, there can be allergy, there can be reactions to various things, any kind of inflammation. So if you have psoriasis, you can get arthritis from that. If you have inflammatory bowel disease, you can get arthritis from that. If you have Lyme disease, you can get arthritis from that. So there is no specific thing that you say, oh, arthritis is caused by this. No, so you have to know why you have arthritis. Why? If your joint hurts, it can be one joint. Just this joint right here hurts and none of the other ones. And that could be a reaction to something like gluten. You could have gluten sensitivity and just have a single joint problem. I've had a lot of people, like what Leslie was saying about the Whole30, just go off sugar and their arthritis goes away completely. And these are people with really severe, like it hurts to move arthritis every day. I have a hard time getting out of bed because I feel real stiff and squeaky. They go off sugar and it goes away completely. I had another woman. This was a really interesting case. She had like severe, like, you know how the rheumatoid arthritis, they have their hands and they can't use them very well. All they can do is like pinch things like this because their joints are so messed up. She went off tomatoes, just tomatoes. It wasn't even nightshades, it was tomatoes. And she's like, wow, like I can move again. Like everything starts working again. And then she, after a long time, months, she ate something with tomato sauce in it. And it was like, oh man, I'm real stiff. I can't move anymore. And she goes, I know, I'm never going to eat a tomato again. So don't like assume that because you have arthritis and someone else tells you, oh, I did this and my arthritis went away. Don't assume that that's automatically, oh, I tried that, it didn't work. Well, you can try it, but sometimes what I do is I go through different testing. So I'll test people for food sensitivities. I go through and that's not an end all be all. You know, the best test is what Leslie did, and that is like an elimination diet. So that's like doing the Whole30 is something like an elimination diet. You're eliminating a whole bunch of things out of your diet. Anything that's processed, anything that's not whole food, you're eliminating that. And that's a good way to do it. The common ones are gluten, wheat, milk, dairy, eggs are fairly common, nuts and seeds, nightshades. And sometimes if you just go off those, then the arthritis will go away. And that's how you know. And then you add one in at a time. Add one at a time, one at a time. And then see what bothers you, which one it was. But if you go off those and your arthritis doesn't go away, that just means it's not those. It could be something else. And you could have more than one. That's the problem. Where like an elimination diet is helpful if you go off everything at the same time. Because if you have, you know, like both wheat and dairy, and you go off dairy, you still have wheat, and you go off wheat, you still have dairy. So, you know, you got to do both of them to get better.
Can you expand on how food allergy actually leads to arthritis? Like why would eating, you know, eggplants cause crippling arthritis in the hands?
Inflammation builds up in the body, and it affects the joints more than anything else. Okay, so the joints are being used all the time, and they get worn out, and they require sort of a constant amount of fluid in them. There's like gel inside that keeps them moving really smoothly and nicely. And if you don't have that, if you start getting the dry joints, it really, any inflammation anywhere in your body can cause that. So food allergies, it's not from the food itself, it's the inflammatory reaction in your body that's going on, that's limiting the amount of joint fluid you can make. They used to think it was antibodies attacking your joints. It turns out that's not necessarily what's going on. It's really the inflammatory processes. Yeah.
I also wonder too, I've heard you say the body likes to mix it up, like different types of foods, different types of bacteria, and that kind of thing. So sometimes I wonder, I think this is, my own idea that I put in my head. But I am a doctor now because I've done so many episodes of this. But
Practically.
if you are eating enough of the same foods, like say you eat a tomato 3 meals a day for 3 years, at some point, is it almost like your body's like, don't you dare give me another tomato? I'm having a reaction to this.
No, it's so much more complicated than that. Some people just, they have a garden full of tomatoes and they're growing tomatoes in their hothouse and they're, tomatoes year round, tomatoes, 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 and never have any issues. Other people, they eat one tomato and they're like, ugh,
Yeah.
I can't have this.
And I remember the tests that you could do. So you can take those tests that kind of tell you, for example, I think I had nightshades come back on mine as at that time like a moderate. They don't call it an allergy. I think it's a sensitivity or something like that. But it seems like you told me the interpretation of that is that there's just high amounts of that in the body at the time when you tested that. Is that right?
There's high amounts of antibodies, and these IgG antibodies are made when something foreign gets into your blood. So when you get a shot, an injection, they have to inject it through your skin into your blood. It's just get in the blood so that you can make these IgG antibodies against that whatever thing, whatever virus or whatever you're getting a shot for. By the same token, if you're going to make IgG antibodies against a food or something, it has to get into your blood. And so that's where the leaky gut we talked about last time comes in, where you can actually get foods, whole proteins, like enzymes and things from foods getting into your blood directly. And then the immune system is going, hey, that's not supposed to be there, and attacks it. And if it happens frequently, then you're building up more and more antibodies against it.
Oh, okay. So that makes sense. That's why I had the wrong vision in my mind. All these years, I could have just asked you. All right. Good to know. That's why we do these webinars. Okay. Now, where were we now that I interrupted you?
We were talking about food sensitivity and allergies causing arthritis.
Yep.
And it's not a direct thing, it's an indirect thing. Whenever you have inflammation, if you have gum disease or psoriasis, skin, inflammation or eczema or something, you can get arthritis. It's not specific to any one kind of inflammation.
Because I brought this up, if someone wanted to do some food allergy tests, this was several years ago. Every time I'd ask Dr. Saunders, can we just test and find out if I have an allergy to this? He's like, just stop eating it. You'll find out. But I'm like, no, give me the test. That's so much work. But anyway, so I think at that time I had done, what do you suppose? What do you suppose a food allergy test? Which ones have you used?
I usually use the Genova Diagnostics antibody test because it looks at IgA, IgG, and IgE, which is the IgE is the true allergy. That's like, you're allergic to peanuts and you get a peanut and your throat swells up and you got to go to the ER, get an EpiPen shot or something. Though that's the IgE allergies. That's the bad ones. The food sensitivity is IgG, or the IgA is what the irritation in the intestines. That's where you get inflammation directly in your intestines from reacting to foods.
Mm-hmm. Interesting.
That's like celiac disease is IgA, for example.
So besides removing foods, is there anything you can add to help you reverse or get rid of arthritis?
Okay, so arthritis, yeah, that's a great question. What do you do? So people say, well, yeah, they have if you have arthritis, do this. Well, how do you know what to do if you don't test, if you don't know what the problem is? So if your problem is tomatoes and you're taking gluten out of your diet and you go, I've been on a gluten-free diet for a year and I still have arthritis. Well, duh, that's not your problem. You got to take the tomatoes out. It's not going to work. So there is no arthritis, just do this. It's actually testing, causing or finding the underlying cause. Where's the inflammation coming from? Is it from food? Is it from other toxins or pollens? Do you have a deficiency of some kind that's causing it? Do you have inflammation for other reasons, like Lyme disease or some other infectious disease? Chronic infections cause arthritis. Inflammatory bowel disease. And some people, they go, "Oh yeah, I have a bowel movement 3 times a day, and it's kind of watery, but I live with it. It's okay. But I got this terrible arthritis." They like downplay the intestinal problem, and then the arthritis is one sign of that. And so fixing your intestines, getting your bacteria right in your intestines. And sometimes you have minor symptoms in the intestines, but people they start taking a probiotic, or they get a really high fiber diet and fix their intestinal issues, and make more of what are called short chain fatty acids like butyrate, which decrease inflammation. And so they change their diet to I'm just going to eat high fiber foods, and then they increase their butyrate and their arthritis goes away. So finding the underlying cause, where is this? Is it coming from the intestines? Is it coming from pollens in the air? Is it a deficiency or a toxin or an infection? Just looking for the cause. That's what you got to do.
Right. All right. I want to see what questions we have. Oh, okay. These are a lot of good questions. I'm just going to start digging into all of them. So some of them will be related to this and some won't. But Beverly says, do you have any generalized recommendations for osteoarthritis besides exercise?
Okay. Yes. Okay. Osteoarthritis is a degenerative joint condition. So what that means is the joints are not repairing. Okay, they're supposed to repair, and when they don't repair, then they wear out. And so if you look at like an osteoarthritic knee, you see normally there's a space between the two joints, and when there's no space, it's called bone on bone. And that means when you're running, you're like pounding bones. There's no cushion, there's no cartilage between there. That's like the rubber that makes everything bounce and move smoothly and everything. So that can be a really painful thing to have. So the question is, why does that happen? Well, it's because you're not repairing, and that could be because of inflammation. But what's really interesting is we've discussed this in the past of having the 6-10 reset. And reset means repair. So your body needs to be anabolic every day. If you're not getting anabolic, you're not repairing. So as you're walking around, as you're doing things, as you're just doing life, you're going to be wearing out your joints. You're going to be making tears in your tendons and your muscles and little tiny microfractures in your bones. You don't feel all that stuff going on. These are like tiny, but they add up over time if you don't repair them every night. And so you get to repair every single night with the anabolic metabolism. And that's what the 6-10 reset is all about. It is going into anabolic mode every night to fix all of this stuff. So one important thing is to not eat anything after 6. In fact, the best thing you could do is skip dinner. So eat breakfast and lunch. 2 meals a day is great if you eat breakfast and lunch and skip dinner. 2 meals a day is not any better if you skip breakfast and eat dinner. Why? Because the anabolic metabolism happens at night. And if you eat, then you're catabolic because you ate. So you have to be anabolic, which is in the morning when you release all of your cortisol, you become catabolic, and that's when you need to eat. So that's why. So I think we've talked about that a lot in the past. So the question of what to do, it's really simple. It's only one rule. go to bed before 10 o'clock with an empty stomach. That's the rule. And it turns out that the earlier you stop eating, the better. So the longer your stomach is empty in the evening, the better. So if you just eat one meal a day, make sure it's breakfast. That's the only way you're going to get benefit from that. So if you eat 2 meals a day, have breakfast and lunch. And I usually eat, breakfast in the morning before I go to work. And then around 3 in the afternoon, I'll have lunch. And then skip dinner, and that will help a lot towards going to the anabolic side and repairing all the damage that's been done during the day.
All right.
What else for osteoarthritis? Okay. The other thing about osteoarthritis is to provide what's needed. So there's something called glucosamine, chondroitin, MSM, vitamin C. And those are sometimes deficient, and they can really go a long way towards providing the building blocks for making cartilage and making things function again.
And Beverly, the one who had asked that, said, I have a recurrent dislocating patella. X-rays show no cartilage and bone on bone.
See, that's that is actually a genetic problem. It's common in women. It's very rare in men, and it's really hard to deal with. So, and that kind of a thing, they may recommend you have a knee brace, and then, but still do all the same things. Do the 6-10 reset, and then add on those supplements to build cartilage. And if you don't exercise, it doesn't get better either. So, kind of like. Yeah, it's a process.
What about castor oil? I've seen some people put castor oil on their hands. Is that something that would work?
I have had a lot of people tell me it works really well, that it's great for removing inflammation, for initiating repair. I don't know why it works. And I've done some research on it, and there was a medical intuitive named Edgar Casey many years ago. This is like the turn of the 19th century into the 20th century. Well, anyway, a long time ago, and he often recommended castor oil for these inflammatory conditions such as arthritis, osteoarthritis, and various other inflammation problems. And it works. Sometimes I've seen it work.
Cheryl, do you know what the name of that lady is who's all over like Instagram and stuff that does the castor oil? Is it Barbara something?
Oh, is she from Australia?
Yeah, Barbara from Australia. Yeah.
Is it
she's good.
Oxalic acid? I should probably look it up.
I can't remember. She's fun to watch. I mean, she just teaches well.
Yeah, she does. She's good. I
can't think of her name, but I know that she promotes castor oil a lot for a lot of things.
Ricinoleic acid. I should know.
Yeah, ricinoleic acid. So have you ever heard of ricin? Ricin is one of the most potent toxins known to man. If you get it inside you, it will kill you. If you eat castor beans, it will kill. The ricin will kill you, and there's no antidote. It's pretty dangerous, but castor oil is fine. It doesn't have any ricin in it.
I think we just talked about this maybe even last week, or unless it was yesterday. I don't know. We did talk about it, I think, on a webinar once. All right. Let's see here. Steve said last week you mentioned that potatoes with green should not be used even after cooked. Does cutting the green off before use render it safe, or is the toxicity throughout the potato no matter what? Does the green on an onion mean the same thing?
No, the onion doesn't mean the same thing. And sometimes the garlic will have the green on it. And that doesn't mean the same thing. And the potato, apparently, I looked it up last week, and the source that I had said, once that green layer forms, then it's throughout the potato. And just peeling off the green isn't good enough.
Mm. Barbara O'Neill or Neil, if that's how you
Yeah,
pronounce
yeah. Barbara
it.
O'Neill. Yeah, that's who it is.
Yeah.
She's the one.
Yeah.
She's got great YouTube videos.
Mm-hmm. Okay. Ron says, with a CT scan calcium score of 785 and high lipoprotein A, would you recommend nattokinase or would you recommend lumbrokinase?
Okay. I looked into this and did some research. So just so that everybody knows, 785 is pretty high. And that means there's a lot of calcium that has built up in the arteries of the heart. It's called a coronary calcium score. And the calcium deposits are there because of chronic inflammation, and then clots form. And then the clots, rather than dissolving, they organize and make scar tissue, and that's where the calcium deposits in the in the walls of the arteries. So, then with that high of a level, that's telling you that you do make clots and that you don't dissolve them well. And the lipoprotein A prevents you from dissolving them. So that's an issue there. So the idea of how do I dissolve clots that form in my body if I have this high lipoprotein A, LP little a. So then nattokinase is an enzyme that breaks down clots, and it's pretty good. And lumbrokinase is also an enzyme that breaks down clots, and they're completely different, and they work in different ways. And you can take them both together. Some people do. The nattokinase doesn't seem to be as potent as the lumbrokinase. You need less lumbrokinase for the same thing. Nattokinase comes from natto, and natto is a soybean curd. But it's not the soybeans, it's the bacteria that are making the nattokinase. So that's so they extract the nattokinase from that. Lumbrokinase comes from lumbro means worms, so it's actual worms, and they extract this lumbrokinase from the worms, and they can both be taken together. But it seems like the lumbrokinase might be a little more potent. It also is more expensive, so I don't know. You can just take more of the nattokinase, or more frequently. You don't have to take more of it, but if you take it on an empty stomach, it's better than if you take it with food, because it's absorbed better, both the nattokinase, lumbrokinase, because they're enzymes. And if you take them with a meal, then they're going to tend to be broken down because they're proteins. Whereas if you take it on an empty stomach, then they're not going to be broken down as much. Well, I hope that answers your question. It's not an easy question, but yeah, I would take nattokinase or lumbrokinase.
All right. Alexander says, my sister's doctor said that her cholesterol levels put her at high risk of a heart attack or stroke. Her test results were HDL 80,
Beautiful.
non-HDL, LDL, and VLDL 250. LDL, okay, so I'm not sure what this is. Cholesterol calcium 219. Coronary risk 4.1. Appreciate your opinion.
Okay. So wow, 219 with the 80. So that gives her a calcium, or I'm sorry, a total cholesterol to HDL ratio of around 3. So that's not bad, that's pretty good. Be interesting to know what the triglycerides are. But let's start with one thing. Get one thing very clear, and that is level of cholesterol is not related to heart attacks or strokes. Period. That's been proven multiple times. It's 19th century medicine, and there's a whole bunch of doctors practicing 19th century medicine. So she should go tell her doctor, do some research, get into the 21st century, and then I'll come back and see you. because the 21st century, clearly every study has shown that there's no relationship at all between level of cholesterol and heart attacks or strokes. And you can quote me on that because that's reality. So then the question is, does she have heart disease? Well, you know what? She could do a coronary calcium score and see if she has any heart disease at all. There was a study done on people that have zero coronary calcium score. There's no benefit to having any statins or anything at all, which there's no benefit anyway. So let's just leave it at that.
All right. Right. Jean said, I have a similar problem compared to Leslie. Let me explain. 2 years ago, I fell with my right kneecap on the sharp edge of a concrete stair.
Oh.
My tendon on the right leg was ruptured and surgically reattached to my right knee. This operation is called quadricep repair. Ever since I can walk only up to, I think, let's see, she said 1 kilometer. Sorry, I had to scroll down, without support. For distances between 1 to 3 kilometers, I need a cane. For distances beyond 3 kilometers, I need a rollator. I was told by my family physician that for the rest of my life, I'm 74 years old, I would always need a rollator for larger distances. I would like to prove my doctor wrong. How can I do this?
Oh, great. I hope you do that. So people are often told, oh, this is what's going to happen. So, for example, my grandmother, she was given a blood thinner when she was in the hospital, when she was like 60 years old. And she bled into her spine and she got paralysis. She was paralyzed from the waist down. And the doctor came in and said, you're never going to walk again. And she said, like hell, I'm never going to walk again. There is no freaking way that I'm going to go through life without walking. So he said, well, there's nothing you can do about it. So, you might as well just accept reality. She goes, I'm not accepting your reality. I think you're wrong. So she started with her granddaughter. So she started with a pedal. It was a stationary bike. And she couldn't do the pedals. So she had her granddaughter turning the crank for her so that her feet would move up and down. And then she got to where she could push a little bit and then it would come back up. And then she could push a little bit, it would come back up. And then she kept practicing until she could actually ride that. And then she's putting more pressure on her. She could go. And then she was walking with the walker. And then she was walking with a cane. And then she was walking normally. And she lived to be 96 years old on her feet till she was 96 years old, walking. So I love it when people are like my grandma and they say, I'm going to prove you wrong. So here's what you do for that. You had a ruptured tendon, and that's where the quadriceps tendon meets the patella, which is the kneecap. And then when that ruptures off, then they had to repair it and fix it on there. But now it's there. You could walk a kilometer. That's really awesome. So what you do is you just increase it little by little, walk a little more, walk a little more. So walk a kilometer or a half kilometer and then go back. That's one. Okay. And then just add a few more steps every day, And then at the same time, start taking some things that build the collagen fibers that will mesh the collagen fibers into the patella. So you get a lot of strength in there and it won't be inflamed. Because what happens is when people get this tendinopathy, and that's where they've had a surgical repair, but it's not fully repaired and it's repaired with scar tissue. So scar tissue is keratin. Keratin is your hair. Your hair is pretty strong, right? It's not as strong as collagen. Collagen is 10 times stronger than keratin. So if you build up scar tissue, the scar tissue seems like it's solid, but it'll start tearing, and then you get inflammation if you use it too much. And then it'll form some inflammation, so you can't go very far. So all of those issues. So what you want to build is collagen. So here's what you do. You have to exercise. If you're not out walking and going a little further, if you're not pushing the limits a little bit, then it doesn't work either. So because you have to stretch that keratin and get it to be replaced by collagen. And so the way to do that is to stretch it, first of all, and then add collagen peptides. So it's very common if you're 70 years old to have low levels of these certain ones of these collagen peptides, which are amino acids. And if you're missing an amino acid, then you may just make keratin protein to repair it with scar tissue instead of collagen to repair it with a good, strong tendon. So adding the collagen peptides is going to help that. And then add vitamin C. So collagen peptides, vitamin C, and MSM, methyl sulfonyl methane. And do that 3 times a day, just 500 milligrams of each one 3 times a day. Well, the collagen peptide comes in a powder, so you could do like, I don't know, they have scoops in them, like 1 scoop 3 times a day or something. What that does is it continually, you have enough of the peptides to build collagen. The vitamin C is required to make collagen, and so you don't want to be deficient in that. And then the MSM makes the disulfide bonds that bind the collagen together and make a very strong tendon. So what you're going to do over time is repair that tendon as you're increasing your ability to walk the length of walking that you can do.
That's really great information. I hear there are 4 different types of collagen. And the
Yes.
more expensive collagen has all types of 4, but do you need all 4? Do you have to go expensive, or can you buy something with just like one in 3 collagen types?
Yeah. Gosh, I don't know the amino acid composition of each of the different types of collagen. The collagen types do different things. Some of them are for tendons, some are for skin. It allows your skin to be stretchy. So they do different things, and so they may have different amino acids. Do you know what? I don't know. I've recommended collagen peptides for so long, and I've never actually had that question before.
Okay, so I'm looking it up. Type 1 makes up 90% of your body's collagen. Type 2 is found in elastic cartilage, which provides joint support. Type
Yeah.
3 is found in muscles, arteries, and organs. Type 4 is in the skin. And actually, there's a fifth, type 5. Type 5 is in the cornea of your eyes. So,
Oh yeah. So you don't need type 5. You probably don't need, the type 1 is that's the big one. That's the one that makes up your tendons and tendons and ligaments and all that, all connective tissue. So yeah, that's the one, type 1.
All right. Anonymous said, apart from having a genetic disposition in accumulating oxalates in the body, is there any other specific condition that would cause one to accumulate oxalates randomly? Is this condition curable, since there are a lot of so-called healthy foods that are rich in oxalates? Should these foods be avoided for life just because it showed up randomly? What type of magnesium and dose would counteract this condition?
Okay. Wow. A lot of good questions here. Okay. So oxalic acid is a waste product. It's from metabolism. And it's part of the breakdown of certain amino acids. And you end up with this oxalates. So there's a genetic predisposition, and then there are foods that contain oxalic acid. And what you said about the magnesium, it's a great idea if you take magnesium with the food. And what kind? Not the chelated kind. Take the magnesium oxide, for example, that's not chelated, because what you want, excuse me, what you want this magnesium to do is to bind the oxalic acid in the foods that you're eating. And so if you just take a small dose, like one pill with each meal or something like that, then it will hold on to the oxalates, and then it won't be absorbed into your body, and it'll just go out in your colon. So that's one way to lower the amount of oxalates that you absorb from your food, but you still have this internal production of oxalates. And there are things you can do to limit that. For example, if you limit fructose, fructose is made into glycolic acid, which is related if someone has like type 1 oxalic aciduria, they make this glycolic acid. But if you don't eat fructose, then it's not made into that, and you don't get the excess oxalates being produced. So that's one way to avoid it. And fructose, we discussed last time, is found in any sweet sugar. So sucrose, honey, coconut sugar, agave nectar, et cetera, et cetera, et cetera. They're all maple sugar is half fructose. So avoiding things that taste sweet is a good way to avoid fructose. Even fruits, like mango has a lot of fructose, and grapes. So the things that are sweet, they have a lot. So if you avoid those kind of things, then you'll make less. And there are, and that's being made in your body. That's a different issue from the oxalates that are in the food. So that's not going to be affected by the magnesium, for example. And it might be a good idea to test and find out what type of genetic, if you have a genetic problem, of oxalate. There's type 1, type 2 oxaluria, which are the more common ones. And because then what you do is going to be different depending on what type you have. And if it's not genetic, then what are the other reasons why it might be happening?
All right. Okay. Tommy said, I'm on phase 3 of the Healthy Heart Program, and I noticed the last couple of months my right side of my neck is a little swollen. I've been cutting down on the supplements like once or twice a week. Now it seems to be going away. Is there one of those supplements that would make the neck swell? It's hard to get the fiber I need. Should I take a fiber supplement?
Fiber supplements are okay. The only issue I have with fiber supplements are that they're narrowly focused. So when we made fiber greens, for example, for Barton Publishing, we tried to get a lot of different types of fibers, not just inulin. It has the Jerusalem artichoke. It's got a combination of fibers. So a fiber supplement wouldn't be a bad idea, and that's okay. Ideally, you get it from food, and you just eat a bunch of different kinds of food. So, mushrooms have different fiber than root vegetables. Jicama is a different fiber than carrots. So, all those different fibers, they feed different types of bacteria in your intestines, and they give you something called resilience. So yeah, fiber supplement will be fine, but ideally, eat the food. It's a better way.
All right. Anonymous said, will ozone injections in the knee alleviate pain?
Well, that's an interesting thing. So many years ago, people tried this method of causing irritation in a joint that causes arthritis, that joint that has arthritis in it. And, might even be worn down bone on bone. You might have a completely osteoarthritic joint, and they say, oh, you need a knee replacement. And they tried injecting different things into the knee to see if anything would help. So there's something called prolotherapy, where they use a hypertonic glucose solution. So sugar, essentially just glucose, but it's hypertonic, means it's concentrated. And what it does is brings a bunch of fluid into the area. When it brings fluid into the area, there's a bunch of glucose there. It also brings fibroblasts in the area. The fibroblasts repair joints. So you're essentially causing some inflammation, and because you're causing inflammation, it's allowing joint repair. And that's not an unusual thing. For example, if you take ibuprofen for knee pain, ibuprofen blocks the inflammatory process, which prevents the repair of the knee. So people who are taking ibuprofen for arthritis are preventing their knee from ever repairing, because that blocking that inflammation also blocks the repair of the joint. So now go to the ozone part. So what is ozone? Ozone is an oxygen-free radical. That's what it is. It's causing oxidative damage. So you're injecting what? Ozone into a joint to do oxidative damage? Well, yeah, because that creates inflammation. That oxidative damage goes, and the inflammatory process goes, oh, we better repair here. And it starts the repair process. And there's actually some pretty good research to show that that works. So both the injections with the hypertonic glucose solution and the ozone therapy, prolozone they call it. And so yeah, that's a possibility for osteoarthritis. Your joints worn, and you want to start getting it repaired. But you know what? If you're doing that, make sure that you do those other things that we talked about. That you want to do the 6-10 reset so that you're anabolic, because that's when the repair is happening, is when you're anabolic. And then number 2, take those supplements, the MSM, glucosamine, chondroitin, vitamin C. Take those so that you can provide the building blocks so that you can repair the cartilage.
All right. Next question. Do you drink the castor oil?
No. Don't drink castor oil. You put it on.
Sorry.
Yeah, you put it on the outside.
All right. You can look up castor oil packs. That's how I see a lot of people applying them to different parts of their bodies. And
yeah, they even make them. You can buy them on Amazon. They come in a filled up with castor oil pack and it has the sticky tapes on the side. And you just put it on and it sticks.
Mm-hmm. Okay. Tom said, I used to have a lot of knee pain. I chose to take hyaluronic acid, a joint formula from Purity Products, rather than glucosamine chondroitin. I've taken it several years and don't have knee pain. What's the difference between these?
Hyaluronic acid is one of the building blocks of cartilage. And, taking it could stimulate the production of cartilage, and then you would no longer have knee pain. Even when you have bone on bone, you think, oh, there's no cartilage there, that you can't repair that. That's not true. You can get your cartilage back. The bone is made of cartilage. So there's always chondrocytes there. Those chondrocytes are the cartilage cells that do the repairing, and they can build cartilage and they can make it. And hyaluronic acid is one of those things that's required to make the cartilage.
Let me see here. We maybe didn't address this. The swelling in the neck, a supplement that might do that.
Yeah, that's right. The swelling in the neck. That was the other part of the question. Okay. So I don't know why the neck would swell, and I don't know what the swelling in the neck is, and I don't know where in the neck it would be, because is it the swollen lymph nodes, or I remember seeing a patient that got like down around where the what do you call it, around the clavicle. There was some swelling when she had a reaction to something, but I don't know if the supplement could be causing it. So here's what you do: go off the supplements, and if you say, oh, the neck swelling went away, and then you start taking the supplements again, they come back, they go, okay, that makes sense, then that's probably what's doing it.
Should castor oil be instilled in the eye for moisturizing dry eye?
I've heard of that, and there was one woman that I know that was trying it, and she just put it on her eyelid, and she would every night every morning, every night and morning, she would just put castor oil. She just rub it onto her eyelids, and she said that worked really well. So I don't know. I don't know about putting castor oil in the eyeball itself.
I watched someone, an eye doctor, talk about it and saying that she's heard that as well. She hadn't tried it, but patients coming in had said it was effective, and then they also said their eyelashes grew.
Yeah,
Because
I've heard that too.
castor oil can help your eyelashes grow.
Mhm.
This is what I've heard.
Beverly said, when I was given an infusion of iron dextrin, I had an anaphylactic reaction, which included arthritic swelling and pain in joints of my left hand. They have persisted. First of all, Beverly, how old are you? Can I ask that? Because you've had a lot of very interesting things that have happened in your body, but you seem to be handling them very well, which is impressive. Okay. And then she said, my chondritis yielded to rest. PT helped my knee, but it acts up sometimes. I have inflammation in my back, L4, L5, and L5S1, for which I get epidural shots about every 6 months.
Okay, so the acting up of arthritis is a sign that there is some ongoing inflammation of some kind. And so again, what you want to do is find the source of the inflammation. So the iron dextran isn't necessarily the source. The iron dextran was a reaction that is sort of like what starts it, and in like that area, like your hand, for example. And then because there's ongoing inflammation, then that's recurrent or recurrent or recurrent. But it's not because well, it initiated because of the iron dextran, but the ongoing process is whatever the ongoing inflammation is. So looking for what is the cause of the ongoing inflammation? Do you have a chronic infection? Are you eating something you're sensitive to? Is there something in the air? Do you have toxicity of some kind? Are you missing a nutrient? Do you have a genetic abnormality? Looking for the source of the inflammation is the best way to go.
Okay. And that is it for today. Dr. Saunders, thank you so much.
All right. See you
This was
next week.
great. Bye-bye. Lots of good questions. Come back next week, everyone. You can find out more about these webinars at bartonwebinar.com. Thank you,
He's
Cheryl.
such a wealth of information, isn't he?
Yeah,
Yeah.
so much good stuff. And if you have some extra time today, go to bartonwebinar.com, check out the past webinars that we've done, and I think you'll be happy. Lots of good information out there. So thank you all.